This is Brad Bailey. I'm here in Houston, Texas at the Texas Heart Institute at St. Luke's Episcopal Hospital. I'm here with Dr. James T. Willerson, who is president of the Texas Heart Institute. We're discussing the issue of philanthropy and heart disease and the link between how corporations can assist nonprofit organizations in this tough economy.
Heart disease and vascular disease are the #1 killer in the world. In the United States and in almost every country of the world. We've made a lot of progress. But thinking about things such as being able to tell an individual about his or her risk of a heart attack or stroke from their genetic and proteomic profile, we're still a little ways away from that, maybe 5-6 years, something like that, but making rapid progress. We already can patch heart attacks with adult human stem cells, patient's own stem cells. I think in the next 10 years, next 10 to 20 years, great progress will be made with stem cells in really helping patients who've had heart attacks, who have heart failure, who may be having arrhythmias of their heart, who have had strokes, maybe even dementia with stem cells. And somewhere between 15 and 20, 25 years, we'll regenerate whole hearts. As physician scientists, we need as much help financially as we can get in combating these diseases. The progress made to date is a result of the contributions of the American Heart Association as far as heart disease, vascular disease are concerned, and strokes, and also the National Institutes of Health. But there have been many generous people throughout our country who've also given very large amounts of money to help establish research centers, research buildings, to help recruit outstanding scientists, to help train scientists, contributed to programs that come out. This is true in many different areas of cardiovascular research. It's never been more important than it is right now. Until the stimulus package from our President and Congress, the NIH was funding grants that were approved at about a 2 or 3% level. Excellent grants, work that needed to be done, wasn't getting funded. Now for a 2-year period with the increased financial support for the NIH, we will have more work funded. That's important. But it doesn't have the kind of longevity to it that one still needs. And so I'm always very grateful when a patient of mine or any patient or person gives unselfishly to help us find the cures of certain kinds of cardiovascular disease and develop the treatments for them and ultimately the prevention. Here in Houston, Texas, people are extraordinarily generous, giving very large amounts of money to build this Texas Medical Center, which is the largest in the world. And much of that's been built through philanthropy. Far-sighted, generous people who really want to help eliminate sudden death and the burdens that heart attacks and strokes cause in families. But one way to look at the economy and philanthropy is that if we could prevent some of these diseases, truly prevent them, healthcare costs would fall markedly. People wouldn't be in hospitals. We wouldn't have the kind of healthcare costs that we have today. If we could prevent disease, if we could interest young people in doing the right things and inform them from early ages. And I think that would be an enormous help to everybody.
Thank you. This is Brad Bailey here in Houston, Texas.